Adrenal fatigue is the 21st century stress syndrome. Are you tired, worn out, or just cannot regain your normal energy no matter what you do? Have you seen countless physicians who have obtained innumerable tests only to be told the tests are normal and the most likely you are just depressed? Have you read many health books but have yet to find the answer to your symptoms? Well, if you have answered yes to any of these questions, you most likely have not discovered the real reason for your problems. If you are sick and tired of being tired and sick, adrenal fatigue may be the reason that has not been considered or that you have not found. Adrenal fatigue, technically called hypoadrenia or hypoadrenalism, has been one of the most prevalent yet rarely diagnosed conditions for the last 50 years. Despite being described in medical textbooks in the 1800s, and despite the development of effective treatments since the 1930s, most conventional physicians are unaware that the problem exists. You have two adrenal glands, about the size of walnuts, that sit atop each kidney. The adrenal glands are your stress glands and produce powerful hormones to combat stress and help you deal with stress and change. The adrenal glands produce two important hormones, DHEA and cortisol. In the face of emotional or physical stress, injury, infection, inflammation, allergies, or hormonal decline, the adrenal glands respond by producing the stress hormones DHEA and cortisol. If the stress remains chronic and continues, the adrenal glands become fatigued and produce lower and lower levels of cortisol and DHEA. The adrenal gland's ability to function also decreases to some extent with age. Cortisol potentiates the immune system's ability to fight infection. Cortisol also promotes the function of thyroid hormones and the sex hormones, primarily produced by the ovaries and testes. Cortisol is the body's natural anti-inflammatory hormone. Symptoms of adrenal fatigue include morning fatigue, especially profound morning fatigue, joint or muscle pain, diminished libido, recurrent infections, low blood pressure, fainting spells, hair loss, irregular menstrual cycles, insomnia or sleep disturbances. People who suffer from adrenal fatigue frequently have erratic or abnormal blood sugar levels in the form of hypoglycemia. In fact, nearly all patients who have been diagnosed with hypoglycemia suffer from some degree of adrenal fatigue. The decreased adrenal function causes the person to have more issues with allergies, asthma, arthritis pain, and a decreased immune response. Most women who have low adrenal function may have premenstrual tension as well as increased difficulty with menopause. The adrenal glands also have an effect on mental stress. As a result, people with adrenal fatigue show a tendency towards increased fears, anxiety, depression, mental confusion, brain fog, and memory difficulties. They often have less tolerance than they normally would and are more easily frustrated. When the adrenals are not secreting the proper amounts of hormones, insomnia or disturbed, non-restful sleep is often an issue. As adrenal fatigue progresses, it lays the foundation for seemingly unrelated conditions such as frequent respiratory infections, allergy, asthma, frequent colds, and a number of other health problems such as fibromyalgia, chronic fatigue syndrome, hypoglycemia, adult onset diabetes, autoimmune diseases, and even alcoholism. These people may appear to friends and family as to be lazy or unmotivated or have lost their ambitions, when in reality quite the opposite is true. They are forced to drive themselves much harder than people with healthy adrenal function to accomplish life's everyday tasks. At the Wycoff Wellness Center, we begin the diagnosis of adrenal fatigue by obtaining a detailed history and physical. Often this is all that is needed to establish at a minimum the suspicion of the problem, let alone the actual diagnosis of adrenal fatigue. Adrenal function may be assessed by a number of blood tests or a 24-hour urine collection measuring adrenal hormone levels. The most reliable test that we use at the Wycoff Wellness Center is a 4-vial saliva collection. This is an easily obtained test that is collected at home by the patient spitting into a small vial or tube. These samples are collected at 4 different times during the day and sent to the laboratory for analysis. A detailed report is returned to the physician's office that provides specific analysis and recommendations. Treatment of adrenal fatigue involves helping you understand the problem and working to try and reduce or eliminate stresses in your lives. This would include addressing physical stressors such as underlying medical problems, along with dealing with emotional stressors. An appropriate, healthy diet that stabilizes blood sugar levels is important. This is often a challenging process for patient and physician alike. Vigorous supplementation of critical nutrients to support the adrenal gland is a cornerstone of therapy. This includes high doses of vitamin C and B5, two critical nutrients that support adrenal function. A number of herbal products and adrenal extracts may help improve adrenal function in many patients. The replacement of needed sex hormones such as progesterone, testosterone, and DHEA often has a profound effect on improving adrenal function. Bioidentical cortisol is often needed initially to support and improve adrenal function. Bioidentical cortisol is a compounded, natural form of cortisol available through a compounding pharmacy by prescription. This is a safe and effective way to help address adrenal fatigue and often the only treatment that is helpful. The dose of cortisol varies from individual to individual and needs to be monitored by an appropriately trained physician. The treatment course for adrenal fatigue often takes 1 to 2 years to get complete improvement and resolution of all symptoms. Adrenal fatigue is real. Adrenal fatigue can be diagnosed and successfully treated. If you are sick and tired of being tired and sick, keep looking for the underlying reasons that are impacting your health. Please take a few minutes to continue browsing our website for additional information. Go to the Test Your Health section and take the adrenal fatigue test. Please contact our office via email or phone for additional information or to schedule your first appointment. The Wycoff Wellness Center. Our results can change your life.